time to introduce you to our studio guest this morning to talk about something really, really interesting. Like I had mentioned to you earlier on, this is actually the first time I've heard of it.
Yeah.
So I know that there'll be others watching this morning
Yes.
that aren't too familiar with the services provided in terms of health. So. I leave it to you.
This is under our Let's Talk segment. Now we've got with us this morning Mrs. Arieta Vereivalu. She's a staff nurse, of course, at the Suva Health Office. A very good morning to you, staff nurse. Thank you very much for coming this morning. Now, you've actually, we've been in talks about these two programs that's currently running, and one that I know that our viewers will be, some will, just like Ty and I, sparked about, is you've got this program running on an initiative that's going called the Home Base. Home Base. Mrs. Vereivalu, maybe you just want to talk about, how this started, how this started out for us.
The Home Base program, this is our 5th years of running the program. The founder is one of our champion, the sister Penny Nandrovesi.
Okay.
The thought of taking patients back to their home rather than holding them back in the hospital for too long. So we more like concentrate to patients that have diabetic foot sepsis, cancer patients, stroke patients, and RHD, cardiac patients.
Right.
Yeah.
Okay.
For those patients, the doctors in the hospital, they refer the cases to us.
Okay.
And we take them home.
Okay.
Yeah, the hospital setting is more like at home.
Okay.
Yeah, we make sure we give advice to the family members how to look after their patients, their medications, their diet, where the dietitians coming with us to advise the family members what they're supposed to eat, and the physiotherapist for the exercise.
Right.
Yeah, and then we make sure that the patients refer back to the hospital or the health centers for their special clinics.
So basically, Mrs. Vereivalu, what you're saying is Home Base is an initiative that's been running for 5 years, and you actually, for the patients that have been discharged from hospital, you actually administer the same care that they would have in hospital, but you're doing that at home.
Doing it at home.
Wow. I mean, and this has been running for 5 years. How many nurses are involved?
Well, we have 6 nurses so far out there in the health centers.
Okay.
Yeah, they look after home-based care.
Okay. And you're going out into rural areas? And
we're going out to Vudindawa, Navua, Corvo.
Okay.
Yeah, and Wanyambokasi.
Okay.
I'd like to know, like, how many patients are you looking after in this home-based program with the number of nurses that you have? Is there enough to do all those visits?
Like before, we run hospital in the home because there's a lot of surgical patients discharging, and there's only 3 of us. With home base, with 6 nurses, in a month totally we will have 2 patients.
Okay.
To each health centers that the nurse will concentrate on.
Okay.
And that's enough for them.
Okay.
To look after.
So depending on how severe their case is, those are the ones that you attend to.
The severe ones, they will be concentrated on them, stopping them, coming back to the hospital for infection, and all that. We keep them at home.
So you're working very closely with the doctors in the hospitals as well. Now, I understand that you mentioned that hospital in the home is being looked after by CWM, Colonial Memorial Hospital, and of course it's staff. And home base is, of course, nurses like yourself. Now, what I want to know is, are you getting paid for your services?
So far, we've paid by the ministry the type of work that we worked. For the type of work that we're doing now, I think that's our own initiative.
Because that's like outside of your work itself. What are some of the challenges that you face?
The transport. How we're going to visit our patients every day. We have to look for our transport. If the transport is there, then it will be okay for us. And the other thing is that where the patients live, some of them are too far that we need to go and visit them. We need somebody to be there with us to support us. We're going to take all our things in order for us to go and look after the patients. Yeah.
Wow, Mrs. Vereivalu, I just wanted to ask, what's the youngest age that you have that you've actually administered? Because I know you deal with a lot of diabetic cases.
Yeah. My youngest one is 9 years old. Yeah, diabetes. We're going home and we make sure we advise them with insulin. The insulin when they go to school, or like the teachers are aware of what happened to the child. Because you know, most of the time he'll be sleeping in school. They have to know that they are under insulin, yeah, so that you know nursing care is there all the time for the child. Yeah.
Are you planning to take on more nurses into the team, like to increase the number from the currently the 6 that you have?
Yeah.
How much more are you looking at?
We need we want to extend it to the Northern and Western Division. Yeah, for the current one that we have in Suva, I think that's enough for us. Yeah, because there's a lot of things to be done. The programs are coming, a lot of programs. Yeah, the Ministry of Health are giving to us, so we have to see on to that. Yeah.
Okay, so right now home base is in Central?
In Central Division.
Central Division, okay.
Yeah.
All right, so you're looking to...
okay, I'd like to know, with the hospital in the home, that's another service which is provided by the CWM. So what's the difference between the two? Is it the same sort of service? Or?
The hospital in the home, they concentrate more on surgical patients.
Okay.
Yeah, this patient, they came out from theatre with amputations and foot sepsis. They admit for 1 day, and the very next day they discharge them at home instead of holding them back in the beds because of the stress of beds that we have. We went home and nursed them at home. We give chance to other people to come in as well.
Okay.
And with that, you'll have a lot more nurses available to provide that service?
We have 2 nurses running that program right now, but I aware the home-based nurse that they have to support them as well. Yeah, they know what to do. The handing over is there all the time.
Okay.
Do you get a lot of support for the services?
Yes, I get a lot of support from the doctors, yeah, and the nurses, and as well as the relatives at home. Yeah, there's a lot of retired nurses and doctors and the teachers. Yes. The word of encouragement that is just have to push us with our work. Yeah, I like working in Fiji because we get a lot of experience.
Yeah. I mean, you're a staff nurse yourself, so you know what you need to do. But of course, medicine-wise, and of course, the Ministry of Health helps you a lot with that.
Because we deal with them as soon as the patient walked in. We know what's wrong with them. Yeah, if they don't take their medication, or even if they lie to us, we know. Yeah, you can't lie to us because we know we never take our medications.
You obviously know your job very well.
You have to true to yourself, otherwise we're going to see you back in the hospital.
So are there success stories, like for those that you have been treating during the service?
Some of the retired teachers, they came to us and like were they bedridden. Yeah, we look after them and they were so happy. They thought, the family thought that they're going to lose them. Yeah, they are survivors now.
Wow.
Yeah, they are survivors and they're very happy to see us that we're still on track with them.
Oh, wow. This is a wonderful story indeed. And of course, for our viewers on Breakfast at Fiji One, these are the 2 services that, of course, has the help and support of the Ministry of Health, together with the World Health Organization, WHO, and of course, the Suva Health Office. Okay, and so these are the 2 programs that Mrs. Vereivalu is looking out for, but of course right now she's looking after the home base. But man, this is, we need to talk more about this.
Yeah, you know what I'd like to do is take our cameras with her and go on one of the trips.
We shall do that. Yeah, we shall. Well, anyway, Mrs. Vereivalu, thank you so much for joining us this morning. We've learned something and know that these programs are out there, and of course our viewers will also know that these are the 2 initiatives that has a lot of nurses, staff nurses, have wanting to do something more and helping in these areas. So it's hospital in the home. It's called hospital in the home, and home base.
Okay. One more thing I wanted to ask: is this service provided to anyone that's admitted at hospital? Anyone, depending on the severity of
depending
the case,
on the doctors, because the doctor they'll do the assessment and they refer to us.
Okay, so it's available for everyone. Okay.